Atherosclerosis is most dangerous when lesions rupture. When an atherosclerotic lesion ruptures, the contents of the lesion spill out into the blood vessel. This can lead to a sudden burst of the contents of the lesion into the bloodstream of the vessel. Fragments of dead foam cells or components of proteins and lipids can all be suddenly released into circulation when a lesion ruptures. When these components are released into the blood from the ruptured lesion, they begin to interact with each other, as well as the wall of the blood vessel, and a thrombus begins to form. A thrombus is a clot that is formed when these molecules that were once inside the lesion begin to collide with each other in the lumen of the blood vessel. As the thrombus increases in size, it can damage the vessel wall and block blood flow through the blood vessel. When a blood vessel cannot provide an adequate supply of oxygen due to a blockage in blood flow, it is called ischemia. Ischemia can lead to severe cardiovascular trauma and death. One example of this is coronary artery disease. When the heart pumps blood, it is only transporting the blood. The cells of the myocardium, the muscular layer of the heart, are not receiving any nutrients from the blood passing through its four chambers. Rather, the blood must be pumped through the arteries of the heart, known as coronary arteries. It is the coronary arteries that deliver the blood that cells of the heart rely on to live. When an atherosclerotic lesion forms in the coronary arteries, the lesion reduces blood flow as it grows into the lumen of the blood vessel. When the lesion bursts, the resulting thrombus can entirely cut off blood flow through the coronary arteries. It is possible the cells of the heart do not receive enough blood to live due to the thrombus, and the cells of the heart begin to die, leading to myocardial infarction, also known as heart attack. If an ischemic thrombus forms from a burst atherosclerotic lesion in an artery in the brain, the blockage can lead to an ischemic stroke and brain tissue dies due to a lack of adequate blood flow. Atherosclerosis can also lead to peripheral artery disease. If a lesion forms or ruptures in the arteries of the lower extremities, such as in the calves, it is possible that not enough blood will be able to flow to support exercise or even walking. Individuals suffering from peripheral artery disease often experience severe pain, sometimes only from walking, as there is not enough blood flow through the legs to support physical activity due to the ischemia from the ruptured lesion.